Since 1981, when my wife Jackie and I founded Canvasback Missions, the organization has focused on some of the most isolated and forgotten people on earth, the islanders of Micronesia.
Canvasback accomplishes this by providing unique volunteer opportunities for healthcare professionals, young people, and really anyone who want to share their talents to help the isolated people of Micronesia.
Micronesia is an American protectorate located in the tropical North Pacific. It covers an area of ocean as large as the United States, and there are thousands of tiny Micronesian islands. Here on Yap, the island of Stone Money, we labor under this straight overhead tropical sun, just 560 miles north of the equator and 3,900 miles west-southwest of Hawaii. This trip we have two teams on Yap, including a group of hand-picked high school youth and their leaders who are tasked with improving the conditions for the children by repairing typhoon damage to the school. Every time they complete a new play facility, it's suddenly swarming with laughing children. Canvasback's last youth team on Yap built this solid masonry administration building for the school. Just 2 months after it was completed, Typhoon Sudal made a direct hit. The terrified people held hands in a human chain and struggled through the flying coconut fronds and flying sheets of corrugated metal roofing to the safety of this building. And here, they rode out the storm. God was looking out for his island people.
The classrooms destroyed by Typhoon Sudal have been replaced and furnished with donated furniture and books sent by Canvasback in a 40-foot ocean container. The roof on the staff quarters has been replaced, but the youth team that is now with us is still finding plenty of damage to repair on that structure. We replaced one stairway that was about ready to collapse under the weight of the resident schoolteacher and her baby.
I like to come out to do Canvasback mission trips with young people because I think it's a great experience for them to have. It's something that they can always keep with them throughout their lives. I think any time that a young person can be involved in a project that will, in one way or another, shape them as an individual to do more service as they grow up and then instill those same types of desires in their own kids ultimately, I think you're really making a significant difference for a young person.
Last week we had the great opportunity to go into one of the local villages that's inhabited by outer islanders, and we shared music with them, teaching them some Christian songs, and also prayed with these people. And some of them were in tears as they shared with us the things that they would like to have prayer for, whether it was sick family members or prayer for their children, or just general concerns. So our young people had the fantastic opportunity to be able to reach out to other people, to share the gospel with them, and most of all, to let them know that Jesus loves them.
The second team consists of 3 ophthalmologists and their support personnel. Their job is to give sight to the blind.
The reason that cataracts here are so much different than the ones that we see in the United States is because they've been let go for so long. Folks don't usually let their eyes go that long in the United States, and yet here they have no access to care. And so they go past 20/25, they go past 20/40, they go on into the very, very low levels of vision to where their hand motions, count fingers, light perception cataracts, and these are extremely difficult cataracts technically to remove.
A Canvasback team can bring $100,000 worth of supplies and equipment, and in just 2 weeks' time, we can provide close to $500,000 worth of care. Even more important, the team provides training, equipment, and supplies so that the local healthcare providers can do some of the procedures themselves. I'm reminded of the Bible passage that says, "The blind see, the deaf hear, and the lame walk."
And this ophthalmology team is giving sight to the blind. And when we send an ear, nose, and throat team or an orthopedic team, the deaf hear and the lame walk.
Would I encourage other medical professionals to come? Well, naturally. It's a very different thing to help people who could be helped by someone else, maybe your colleagues in your own practice. But here we're helping people who would otherwise not get any care at all. And I would encourage the people to come. They will gain more perhaps than they have given. And that is all, and I think that could very well be true.
Our meager financial resources is not getting any better, and in the future it would really be helpful if Canvasback can come back to visit with us and help us with our needs.
These small state hospitals on tiny Micronesian islands simply can't afford to have every specialty with all the equipment that each specialty requires. Or, if they were to refer all of the patients requiring specialty care off island, that would break the budget. The harsh reality is that if Canvasback did not send surgery teams, many people would suffer the consequences of lack of care. The blind would remain blind, and deaf children would never know their mother's voice.
When we had to go to the hospital, we have to pull in a canoe about 2.5 hours. Oftentimes you have to jump in the ocean to pull the canoe with us to go. But now, with Canvasback and the hospital, we have you coming to us. We don't have to go to you. You're coming to us. And we are greatly appreciating this. If you choose to send money to Canvasback Group, we will appreciate this in spite of the vastness of the Pacific Ocean. We appreciate this. But if you choose to join Canvasback as a doctor, we'll not only appreciate it, we'll see you, we'll appreciate you more. Thank you very much.
Thank you, Canvasback. We love you all. God bless.
Come with us to Micronesia.
If you can't come, give a gift to send someone else, and the appreciation of the island people will reach across the ocean to your heart.